and hit that link and invite your family, your friends, your next door neighbors. Even go out there and get the cat to come in and watch it today. Georgia, how you doing?
I am wonderful. And how are you today?
I was great. I forget. Yeah, when I get in those little things like I don't know what's going on, it takes you to another level. I try not to use that kind of language, but
Hey, look, every now and then it has to pop out, That's the
yeah,
way it works.
yeah, that was a
Good
position.
afternoon, everybody. I am Georgia Allen. I am with GA for Just Is. It is just right to be up here with my buddy, my friend, my cohort, Mr. Henderson Vaughn, who
All right, all
each
right, all
and
right.
every week, we call him Captain 85.
Yeah.
Each and every week, Captain 85, the Dream Maker, opens up his platform so that we can be on the airwaves to kind of share information with the community. And we bring our listening audience to a conversation. And that is a conversation for information, a conversation for correction, as well as a conversation for transformation. And today we are excited because there's so much going on. And when we think about civil rights, we tend to think about someone got shot or um, a child got dragged in school, or we think of all these horrific things, but we fight civil rights behind the scenes a lot of times. A lot of times, these are things that are kind of hidden. And one of those things is our health, and it is our well-being. It's all about our well-being because in a place where there is institutional racism, we have to recognize that that racism transformed to every part of our community, every part of society, every part of our nation. And so I thought it would be a good idea to talk a little bit about healthcare and civil rights at this time. Um, at our last meeting for the NAACP, NAACP, we had a young lady to come in to talk to us about sickle cell anemia, and it just came to you know, to my temple that said, you know what? I can't remember the last time that we really had a conversation about healthcare and how it can be very destructive in our community. Because keep in mind, with healthcare or without healthcare, it can be very critical in the impact that it has on everything from our children's education. A lack of healthcare can create a situation where our children do not perform well. And so I'm excited about the show today. Healthcare, keep in mind, it is about our mental health, our emotional health, our physical health, and believe it or not, it's our spiritual health as well as our family health. Because if any one of those things are out of sync, it creates a real major problem. So I'm going to chit chat a little bit with you today about how important it is to have advocates that are fighting on your behalf for your well-being. Again, our topic today, our health is our well-being. Without our health, we don't have a good well-being. And one thing about it is I'm excited because it just is the right thing to ensure that the community is informed. We must inform one another about what's going on. Secondly, it's the right thing to ensure that the community gets engaged, because a lot of times we are concerned about things, but we sort of kind of climb inside of ourselves and we feel like there's nothing that I can do. Well, I'm hoping to help you to see there are things that you can do in your community, within your family, to help to have a different outcome. But the other thing, it is the right thing to do for our community because it allows us to provide resources to you or make you aware of resources that are available. Our health is our well being, and that's just the bottom line. Without good health, again, our children do not perform as well. And health, we think of it simply as going to the doctor, getting a shot, going to the doctor, and him checking all of our vitals and others things. But having good health is also making sure that we have equity in the healthcare system. Having good health is also making sure that our young people and ourselves have the food that we need and the food to eat. Because if our food is contaminated, we have the food, but it's not worth eating, which also harms our health. And again, civil rights, we think of it most of the time simply as, we're getting in the battle, we're marching, we're boycotting, we're doing all these various things. But in many instances, civil rights is a lot about making decisions, changing policy, engaging the community, helping to have a different outcome, because constantly having the same outcome is not a workable system when that outcome is not advantageous for you. It's not to your advantage to have these terrible outcomes. So it's critically important that we work very diligently to ensure that we change outcomes. And there's a number of ways that we can do that. We can do that through researching what's going on in our communities. Are we in a situation where there are plants and all types of industries that are in our community that's putting chemicals and things of that nature all throughout our community? Are we in that situation? And if we are, have we looked at what that situation is? Have we become proactive to prevent new chemical plants from coming into our community? Because that affects our health. That affects our health. And part of what we must do, and part of the things that, some of the things that we have to do is, again, when these situations occur, we need to go in and we need to look at what impact that they're having on us. So therefore, we might have to have an impact study. And by doing that, we can identify what are the sources of these illnesses that takes place in our community, because we're the first community that they come to dump anything. When they want to dump something, they dump it in our community. And what does that do? That affects our health. That affects our outcome. That affects whether or not our children are able to be successful or not successful because of what is happening in our community. So keep in mind, we can ask for an environmental impact study. We can ask for that. Now, say, for instance, something has already been placed in our community, is creating health problems, health issues, asthma, any of these things. If they're already there, we can now ask for an assessment of what has happened over time and begin to collect the data. And then we can come together to address this, to begin to change policies. But of course, a lot of times when these things happen, guess what? That ends up being a lawsuit, similar to what happened when people were using baby powder. And then they found out, oh, well, baby powder is causing this problem. Well, there was probably never an impact study done on baby powder. Who would have thought that baby powder would be a problem? Everybody was using it. J&J. Everybody was using it. It was just an automatic. And so what I want you, my audience, to understand is there's always some options. Even when you think there are no options, there are always options. So again, if someone has placed something in your community, in your neighborhood, that is causing some health concerns for you, your family, your neighbors, and it's already there, keep in mind, even though you may not have had an environmental impact study done, you can still have an environmental assessment done. Okay. And those things can be done by using the tools that we have and using the departments that we have, such as EPA. Ask them. We're seeing some things that are very concerning to us. And so we need you to assess what is going on in our area. I'm in Virginia Beach. You may be in another city, another state, or what have you, but keep in mind there are options. Most of you know that I'm with the NAACP, have been with the NAACP for years. So that's why I'm always pushing civil rights issues, because that's important. And so wherever you live, keep in mind, we need people on the ground to work on behalf of you. And so if you are not a member of your local unit of the NAACP, we want to encourage you today to join your local unit of the NAACP, because believe it or not, they are still actively involved in working on issues on your behalf. And we can't do this all of this work by ourselves. We need people to get engaged and to become members of our association. So whether you live in Virginia Beach or anywhere else in the Hampton Roads area, we want to encourage you to get involved, because it is moving, and we're going to move with or without you, but we would much rather move with you than to move without you. We're going to continue. Yes.
Want to ask the question, what is the age for people to join the NAACP?
You can join as soon as you're born.
Oh, okay.
They have a child membership price and an adult membership price. So if you're interested in joining the NAACP, for children, it's $10.
Okay.
For adults, it's $30. And we want to encourage you. And thank you for that question, by the way, because that's something important. People say, well, how much is it? Well, guess what? If there's 30 days in a month, it's $1 a day for 30 days. And the rest of the year you pay for. Okay. So you can save up $1 a day for 30 days, and you have enough money to pay for membership for a year.
Yeah,
membership is renewable every year.
That's a great gift for birthday or Christmas. Gift.
Absolutely. It's an excellent gift to give to others. And it's an opportunity to learn about some of the things that the NAACP is doing, because what happens, people are out there and they're saying, well, I don't know what they do. Well, they have a website. It's called naacp.org. And you can go up there and you can see what our young people are doing. We have awesome young people who are part of various programs. One that the local NAACP region does all the time is what's called AXO. It's the Afro Cultural Technological Scientific Olympics. And inside of that is all of these different programs that they can be a part of. The sciences, the arts, the math, all of these various areas, they can compete for scholarship money. So they compete on the local level. If they win the gold medal on the local level, they can go to the national convention, compete on the national level. And we've had any number of young people from our area who have been successful. And they have gone on to go into industries and all and continue that success. So it's an excellent opportunity. So you can come into the NAACP as a youth. You can come in as a junior youth. You can come in as an adult, or the young adult chapter, or the college chapter. And so there are many, many areas and many ways that you can become a part of the NAACP. And when you become a part of the NAACP, it's an awesome training, a leadership training organization. I just went through 3 days of training to learn more about some of the things that we're doing. And most of the young people that I saw, they look anywhere between the ages of their late 20s through their middle 30s. So, and these are people that are running teams and teams of people, and they have a wealth of knowledge as it pertains to health care or economics or education, wealth of knowledge. So if you're interested in rolling up your sleeves and getting involved in an organization that is working on your behalf from your childhood to your adulthood to your senior citizen age, NAACP is doing that. You can join your local unit by going online and Googling the name of whatever city you are in and asking for the local unit. If you can't find them, you can call National Direct and say, hey, I'm trying to find this unit, and they can tell you where the unit is located. So you have an excellent opportunity to get involved with your local NAACP. And when you do that, you can pick and choose what you want to work on. Say, for instance, you're in communications and you say, you know what? I want to get involved in press and publicity. We have a communication, press, and publicity team that you can be a part of. Say, for instance, you say, you know what? I'm going to go off to college and I want to be an attorney. We have a legal redress committee. You can be a part of the legal redress team and start to do investigation before you even go off to college. You can begin that process right now. Healthcare, if that's something that you want to be a part of, you can be a part of the health committee and educate the community about the various diseases, but also educate the community about the resources that are available should you or a family member have any of those medical issues. Other thing that we talk about a lot is how to become an advocate. Okay. I consider myself an activist most of the time, but we're also advocates. Again, we mentioned this a while back. Serena Williams went into the hospital, millionaire, and she had to advocate on her own behalf because she has an autoimmune disease. And because of that, her carrying a child to term and her delivering a child healthy becomes more of a challenge than someone who's already healthy. But because she was knowledgeable about her situation, she was able to advocate on her behalf. So what we try to help people to understand is go ahead and get you a healthcare advocate now in your family. And it doesn't have to be because of a pregnancy. It could be because of a disease that has come upon you out of the blue. And you want to have someone who can advocate, because what if you temporarily go into a coma? Who's gonna advocate on your behalf if you haven't already put someone in place to be called in the event of an emergency? And so that's why I wanted to talk about health today, because it is so critically important that we have these various, things in place to help us overcome challenges that we may experience. Do you have another question?
Well, I mean, I think with people with the information you give it today, is that most people don't understand is we could cut out a lot of games if they join the NAACP.
Absolutely.
I mean, it's like we got the tools and the way to get things done, but all the money is being fed into trying to reinvent the wheel.
Absolutely.
And
when it's already here.
It's already here.
It is already here. And our job as advocates is to make sure that we have equitable, quality health care. Because keep in mind, a lot of times we do have health care available, but guess what? The quality of the health care is not substantial. It's below the bar. And so if you have persons who are advocating on your behalf and you make them aware that you went into the hospital or you went to see your doctor and the doctor did not perform well, that's where we can come in and become an advocate on behalf of what's going on with this healthcare system. We can also, investigate using the tools that are available, either the NAACP itself or the partners that we have. And they can say, well, this doctor is not up to par, so maybe we need to report him. Maybe he's never been reported. Maybe she's never been reported. But now that we're aware of it, you can now report it. What about the doctor that was out in one of our local cities that was supposed to be a dentist, and he was performing medical care on women, but he was a dentist.
But they want to get
Had
the
no
bag.
OBGYN experience.
They want to get the bag.
So these are the type of things that we look at when we're trying to make sure that their health equity is in place, that we don't have persons out there doing harm to other people. The other thing that we looked at is when we look at healthcare, again, it's equitable food systems. Now, what does that mean? That means, do we have farms that we can get food from that is better than what's being delivered in the grocery stores? Do we have access to good food? Do we have a delivery system in place to bring those foods from the farm to the table? Is that available to us? And if it's not, how do we make those things available? That gets down to health, whether you have good health or bad health. So these are the type of things that we're looking at in terms of civil rights, in terms of justice, health justice, is we are looking at those things. Believe it or not, we are looking at those things, and we're working to ensure that we have better outcomes. Because it's important that, one, healthcare is affordable. Two, healthcare is of quality. We want to make sure that people who are on Medicaid get the same services that someone who goes in with the private insurance. So we're looking at not only affordable, but we're looking at the quality of the care that our people are getting. Okay, we're looking at the insurance. Is the insurance providing the right policy for the people? Or are they giving you a non-relevant policy, but you're paying all this money into this insurance? And then when you go to the doctor says, oh, well, we don't take that insurance. Or the doctor says, when you thought you were going to go in there and your copay was going to be $10, you get there and the doctor said, well, no, we don't. We'll take the insurance, but it's still going to cost you $100 out of pocket. Those type of things are things that we look at from a justice standpoint, from an equity standpoint, to make sure that our people are being treated fairly. We also look at eliminating certain things like food insecurity. We look at whether or not there's an equitable food system, but we also look at, people feeling insecure, when they go to get their foods. We also look at making sure there's a wide access of healthy options. There's one thing to have food, there's another thing to have healthy food. So we want to look and make sure that there are options and healthy options that are available to the community. We also want to make sure that we understand the integration of all of these things, how they affect each other, how your health is affected, is affecting your economics. If I go to work and I am sick 1 week out of every month, that can affect my economics, which means it can affect my housing. So all of these things are interrelated. They're integrated things. Healthcare can impact almost everything in your household. Most people end up having to declare bankruptcy because of a health emergency of some sort. A long-term period in the hospital, a child got sick unexpectedly. Those type of things can affect economics. It also affects education. If this child is out of school for 90 days and is on a ventilator, but the doctors can see that, this child can be revived. He or she can come back to life. Yes, it's a medical issue, but it's not a medical issue that could lead to death. It's a medical issue that needs a lot of care. Well, when they get well again, guess what? That affects their education because they couldn't get the knowledge while they were sick. So all of these things play into each other. Education, economics, health, they all, interrelate. Also, if you wanted to start a business and you're having some health issues, you may have a more difficult time starting that business. So we want to make sure that people have quality, affordable health care so that they have more options available to them. We also want to make sure that we ensure that the community is engaged and educated. It's not enough to have people who want to know about health. It's also important that we educate you so that you can better engage, because it's not really a good idea for you to think you're engaging when you don't have the right information. So you're trying to engage, but you're trying to engage without the necessary tools to engage. So we want to make sure that you have the necessary tools. We also want to draw attention to whenever racism plays a major role in the type of outcome that you have, because when racism is playing a major role in how you receive health care, whether or not you receive health care, it creates other stresses on you. So that also harms your health and your well-being. We want you to be healthy, and we definitely want you to have well-being. We want our health is our well-being. So if we're not healthy, then the chances are our lifestyle, the things that are happening to us throughout is a problem. And so, as a civil rights organization, we're always fighting on your behalf, not just for today, but for the future, for long term. And we work to try to make sure that the things that we do will affect you in a positive way for a positive outcome. One of the other things that we look at when we look at healthcare, we want to know, is it inclusive? Is the healthcare system inclusive? Does it have a good infrastructure, or is it picking and choosing who it is going to serve? That is critical. It is absolutely critical that we know that when we go to the hospital that's down the street, that they don't turn us away and say, oh, well, take a pill and call us tomorrow. One, chances are the pill that they gave us is one of those pills that is called a sugar pill. So it doesn't have any effect whatsoever. So we have to keep that in mind. Coming back home and waiting to call them tomorrow could be the difference in life or death because they didn't service you. So we want to make sure that the health care that we're receiving is very inclusive and that they have a structure or infrastructure that you can go through to ensure that they're following the processes that they should follow in order for everybody to receive the same quality outcome. The other thing that we look for is healthy people, healthy communities, and healthy policies. That is so important. Do we have healthy policies? Are we receiving is the local, state, and federal government putting forward policies that is going to be good outcomes for us as a people? Because most of what happens is one group, based upon skin color, based upon various other things, may receive one type of quality of health care, while another group may receive a different type. And that can even happen within our own community. Again, Serena Williams had a challenging outcome. But within our own community, we have neighborhoods. And so there are different people within our neighborhoods and different neighborhoods that this group over here, maybe in District 8, maybe the majority of the people in that neighborhood are people who have income of 6 figures. Whereas over maybe in a district like District 4, most of the people in that neighborhood may have an income of less than 6 figures. That too can have an impact on health outcomes, because even though the person that is in their district that may not make as much, they could have an excellent insurance policy, but just because they are from one community, it may sort of send the medical facility into a mindset that I don't know, before they even double check to see what type of insurance that person has. And so they're like, maybe they don't want that person at their facility. A lot of people say, well, that doesn't happen in 2023. Oh, yes, it does.
Hello.
Oh, yes, it does. Unfortunately, it happens in 2023. Unfortunately, negative outcomes still happens. Unfortunately, people don't always do the things that they're supposed to do to ensure that all people are treated the same. They pick winners and they pick losers. It's unfortunate, but that's what happens. And that is why it is important that we operate as Kwanzaa always tells us, we operate in unity. And anybody that knows me know I love the 7 principles of Kwanzaa, because the 7 principles of Kwanzaa, no matter what you're talking about, there's a principle that go along with our conversation. In this case, we're looking at healthcare. So we need to look at what it is. It's a purpose. Healthcare, that's our purpose here today. So we want to make sure that our collective vocation or our collective work is the building and developing of our community in order to restore us to the right and proper place. Well, if we do that, if we have people who have medical issues, unless we work with them, unless we unite to improve their conditions and their outcomes, then we haven't fulfilled our purpose. If we don't use the Kwanzaa principle of unity to maintain our family, to maintain our community, our nation, and our race, if we don't do those things, we have not fulfilled our principle of Kwanzaa. So healthcare is critical to that piece. It is extremely critical because we want to have healthy outcomes. And we do that when we work together as a collective, when we work together in unity. It is so important also that when we're looking at civil rights, when we're looking at health and everything, we want to make sure that people are in a situation where they're fully employed and they have a livable wage. Why is that important, you say? Because if people are not employed and they can't afford health care, and most people, healthcare comes from their employment, that creates a problem. It does create a problem. So we want to make sure that we develop economically inclusive and stable, we call them ecosystems, which is a almost like a community within a community. So we want to make sure that we do a couple of things. We want to provide full employment with a livable wage. We also want to control expenses through debt controls, including medical costs. We can do that when they're not overcharging our community and charging us one fee while they're charging someone else another fee. We also want to make sure that our community is aware they're educated, they're literate about the various support systems that are in place, that they can pick up the phone or they can go directly there to talk to someone about the concerns that they have. All of these things determine outcomes. They all determine outcomes. If you don't have them in place, you have a different outcome. If you don't have them in place, you tend to have negative outcomes. And so we're always looking for ways that we can make sure that we're working on behalf of those who may not know. We're working on behalf of those who are being disenfranchised. We're working on behalf of those who may not have received the same opportunity. A lot of this has to do with, as I said, about the type of employment you have or whether or not you own a business. That's the economic side of it. That's the economic piece. But it changes outcomes depending upon, is your business successful, or are you working a business but are doing just barely above what you were making when you worked a job? Are you really making a true profit? And if not, then we got to bring the economic piece in there. Did you get the same opportunity in terms of a loan? As you can see, all of these things are interrelated. If your economics is out of whack, your healthcare may be out of whack. If your healthcare is good, your economics may be better. Okay. If your healthcare is not good, education may be off center. It might not be as good. We've found that persons who have higher education tend to have a better quality of life, tend to have a better healthcare outcome. And so all of these things work in concert with each other: economics, education, healthcare. You don't think about it like that, right?
Yeah.
You don't generally think. No, we generally think of them each as a singular piece. And we're gonna have to stop doing that. That's the other reason why I want to talk about it today, is because we have built, we do our life like a building block. Okay, well, I got this block for this, I got this box for that, I got this box for this, versus I have all these boxes, and let's see how they connect together. Let's connect them, because actually they are connected. They are really connected, believe it or not, even down to politics. Politics is connected to these same boxes. And the reason why they're connected is because if the political system makes policies that are to your detriment, that affects education, that affects your economics, that affects your healthcare. It also affects your housing. Policies from our elected officials ultimately affects all of these other areas. And so that's why it is critically important that I share with the audience today why it is so important to understand our health, our well-being. Our health is our well-being, and we need our people healthy. We need them with quality of life. We need them to have access to the resources that they need to have the type of food they need. Do we have anybody online sending messages to us or anything? Because if
No.
if we do, by all means, share.
Okay. I wanted to ask the question. I mean, you know,
Okay.
it's with even with the health plans they get out now,
Mm-hmm.
because I had changed minds in January.
Okay.
Here you go, May. And I'm still trying to see a doctor. And I did get an appointment yesterday for next week. That was that with another doctor. Everybody is booked up to to June or July to see our primary doctor.
Wow.
And these are the things that happens when we take it for granted that these things are here, even though you got the
Insurance, you paid the
I've been,
policy or whatever, if you
yeah.
owe it, you know.
And just to get to see a primary doctor,
Mm-hmm.
I go to a specialist,
Okay.
but they can't do nothing because I got to see a primary doctor to get a slip from them,
To
even though I've been
approve.
to approve what I've already been going to them for the last 4 or 5 years.
Mm-hmm. And
It's
each year it turns over.
right.
And even if you're at your company and you stay with the same in insurance um, plan, and you don't switch your insurance plan starting January 1, you have to start as if you're the brand new.
Yeah.
The only difference is your doctor knows who you are,
Yeah.
but in terms of how those pieces work, you still have to start almost as if you're brand new.
Yeah.
And the only thing that I could suggest is that somewhere around November, if
Mhm.
you're going to change your policy, you should also be looking at making an appointment at that time
Yeah.
to go ahead and make that. If you if you're going to either change policy or keep the policy the same,
Right.
you want to start then booking your appointments for the next year and all. I know now with my doctors and my dentists
Mhm.
and all, they book my appointments. Like my primary care doctor,
Mhm.
she's going to see me every 6 weeks.
Oh,
When I go in there, they're looking at the calendar.
yeah.
Okay, what works for you 6 weeks from now? And boy, they're plugging it into the system. And when I go to my eye doctor annually, they're already plugging it into the system for the next year.
Oh, okay.
Now, if anything should change, I change my insurance or anything like that. I pick up the phone, I call them, and I say, "Hey, I've changed my insurance. Do you take this insurance?"
Okay.
Or I'm looking to change my insurance. Is this one of the carriers that you take? And that way I can find out as I'm looking, because what is it, around September is when they start telling you you need to start looking at different policies to see if you want to stay with what you have or if you want to change. And so when I begin to look at policies, I look to see if my um, family of doctors are that um, in that group. Is he one of the doctors in that group? So that's the other thing that is important, is that we do our checking ahead of time, and that will probably help avoid us some of that lag time.
Mhm.
Not all of it, but some of it.
Yeah.
Hmm.
And with the situation with the COVID, people being locked up for 2 years, mental health is,
Yes. Yes.
we're faced with a lot of stuff that,
Absolutely.
not used to. And that's why when you say, with the topic, your health is important because you can't, I'm just getting back after
Hmm.
2 years of
Right.
just walking without trying to, them trying to put me on crutches and walkers and all that.
Hmm.
You
And
have,
what does that affect? Affect your emotional health,
yeah,
physical health,
you can't,
mental health,
yeah,
your
everything.
family,
Yeah.
and your spiritual health.
Hello.
Does it affect all five?
Oh yeah, that's what I'm saying.
Yeah.
So the topic that you came up with is very important to discuss because
Yes.
people just look at one thing, but the overall factor is a psychological and physical. Because
Absolutely.
when you go out, like I said, with the haven't been having neuropathy for the last 10 to 15 years, but
Hmm.
after COVID, man, I couldn't even get in the car. I'm scared to drive
Right.
because the effect of the COVID affected the neuropathy in a way that I was unexpected.
Right.
But now, as I done got back in the gym, start
Hmm.
exercising, watching what I eat,
Hmm.
now I'm like, okay, I'm at 85%. I ain't at 90 yet, but
Hmm.
I'll get there. But it's the topic that people sometimes don't discuss
Right.
to find out, really is that what I'm going through?
Hmm.
They wasn't thinking. All they're thinking about bills, bills, bills.
Bills, bills.
You know?
Absolutely.
So it's a good topic.
Absolutely.
Very good.
And that's why I felt it was important for us to have this conversation. And again, we're simply here to have a conversation, to provide information, a conversation when we screw up, when I do. Henderson does everything great.
No.
we have, we have a
Why?
conversation for correction, with, just in case I screw up. And then we also have a conversation for transformation, because as Henderson shared, having this conversation allows you to transform your thinking from, well, it's just medical, when in fact it covers a broader spectrum than just medical. It covers your household. It covers whether or not you go in and out of your household. Because, like you said, when you started feeling, a little anxiety, what did you do? You were like, I can't drive.
Yeah. I know I should have stayed in the house one time. It cost me $20-some $100 because I ran into my garage door.
Oh.
We
don't want that to happen.
not again.
Right.
But I'm better. But these
Right.
are the things that we don't really talk about.
Absolutely.
And because you brought that topic up, it allowed me to, share some things that I went through, and hoping that people get the understanding that, hey, maybe that's what I'm going through too.
Absolutely.
And I need to get some medical or, a mental evaluation to see what I need to do to correct that.
Absolutely. And that is so very important, because we kind of box ourselves in many times, especially us, as a group of people. We don't want anybody to know we're hurting, or we don't want anybody to know that we're struggling, or we don't want anybody to know this and that. It's my business. We're quick to, well, it's my business, none of their business, blah, blah, blah. And yet, yes, it is your business. But sometimes your business can also help other people when they're going through challenges or whatever. Also, when we're looking at health and health equity policies, we got to advocate for safe and harm-free neighborhoods. And what does that mean? One, we need to make sure that there's adequate housing. We also need to make sure that if they're in a place where there's public transportation or not, then we need to help to provide efficient transportation to get them to and fro, because no matter where you live, you got to come out of your house. Okay. And so when we're looking at policy, we're also looking at that as well. We also look at responsive public safety. You notice I said public safety. I didn't say police. Okay. Yeah. We want them to be working on behalf of the public, and people should feel safe to dial 911. They should not feel afraid that when these people come, even though you told them that you have a medical emergency, they come with guns drawn. Okay, that's a policy issue. That's a public safety issue. And so we want to ensure that our people don't have to deal with that type of situation, because guess what? That affects their health outcome. If someone's coming to your house and you ask for emergency help, and they're coming there screaming and yelling, "Why do you call me?" when you're paying your taxes to get public service support, that's a problem. Okay. So that can create, anxiety, that can create other mental health issues. And so you started out with a pain in your side, and now you got a pain all over. Yeah. Not only do you have that pain all over, but your family members also have pains all over because they were affected by that outcome when the public safety person who was supposed to be there and be responsive, sometimes they don't even respond at all. Or if they do respond, it takes hours upon hours before they respond. That can be a problem. That can create another medical issue for you, and it can harm you in many ways. And so that's why we want to make sure that when we're looking at healthcare, we're looking at it holistically. It's not something that we can just put into a little small box and okay, this is the way it is. Okay. We want to make sure that, as I shared earlier, we want to develop some economic systems, inclusive systems that help us to increase our income, so that we can help us increase outcomes, positive outcomes. Hi, Teresa. Thank you for listening. Appreciate you. And the other thing is making sure that we have advocates for equitable education outcomes. Again, we want to make sure that our young people feel safe. They feel safe at home. They feel safe in their schoolhouses. And if they do have any type of medical issue, they want to see a service that is positive and not a service that is negative. If they have a medical issue, they don't want their teachers or the nurse or whomever or the police officer, the school police officer that is at the school building. They don't want them yelling at them when they're already nervous or they already have some type of health condition. So we must be advocates to help engage, but help navigate. That's a critical piece. If you cannot navigate these systems that they have out here, then you kind of like out back, okay? And so what we want to do is we want to try to inform. We want to try to help you transform the way you have been thinking with regards to some of these issues, especially when it comes to health. Because our goal, of course, is to make sure that you know it's our health, but it's also our well-being. Good health can be better outcomes. But if we don't have good health, we don't have good resources, we don't have persons that we can rely on or we can go to, we don't have an advocate, we don't have anyone to legislate on our behalf, then our outcomes can change drastically. And so we are always looking for ways, as individuals, but also as civil rights advocates, we're looking for ways to help to navigate through the system to change outcomes for the better. We're looking always for that. The other thing is, what do we have to do? How do we get these guys involved? How do we get you involved? Again, I want to encourage you, join the NAACP. Join us because we are working on your behalf. Join us. And you can always put a message in the chat. We can get back to you later. And when you join us, share with us what your special interest is, what your particular interest is, because we want you to be in an environment that works for you. So some of the things that we can do to kind of leverage, our advocacy. One, we want to build knowledge. We want to research this. We don't want to just sit here and throw information out at you while doing absolutely no research whatsoever. The other thing is, if these systems are not working in our best interest, sometimes we're going to have to disrupt them. We got to disrupt these systems that don't work on our behalf. So that means sometimes it's litigation. Okay. And so these are the things that we have to do. Sometimes we need to expand our leadership. Maybe the group that we have is not the right group, so we have to expand it, or we have to bring in someone new. So we look to train people so that they're knowledgeable. The other thing is, we want to bring people together. So we foster collaboration. We convene together and work with one another so that we're not only talking to people who are part of our association, but we're talking to other people as well. We're talking to our faith-based leaders, and we're talking to all these different groups so that they are aware and they can too share the information as well. The other thing is, we got to tell our story. If we have been out here advocating on behalf of people for decades, for over 100 years, we have to tell our story. And that's the other reason why I want to share healthcare, because everybody sees us in a very narrow narrow silo, and we needed to broaden that so that don't just see NAACP and civil rights and activists in this teeny tiny little silo. We are much broader than that. So we got to shift the narrative. We got to tell our story about other things that we're doing on behalf of you, me, and others. And then we got to mobilize, activate our community, and let them know that, look, we cannot sit in the same spot. Things are changing faster than the speed of sound, and you need to know. And in order for you to know, you need to get engaged. And when we do that, we can begin to make sure that things are more equitable throughout our community. Okay. And we, use our resources. We do what we called a Black Progress Index. You say, well, what is that? Well, what that does is we take a look at our communities and see which community is having the best outcomes. And we compare ourselves to each other. We don't compare ourselves to the white community, other communities. We compare ourselves to each other. So if I'm living in Virginia Beach and my life expectancy is 77.5%, but you live in a small town in a rural area and your life expectancy is 66%, then we have to go back. We have to look at our Black Progress Index and identify what are the negatives that is preventing you from living to 77 years old. And then once we discover what those things are, then we have to put in place changes so that you can have a different outcome. With that being said, I am coming up to the end of the show, and I just want to close again by thanking you and letting you know, please feel free to share this information with others. Send it out far and wide. You can send it through YouTube, Twitter, and all these various things. But I just want to encourage you to join your local unit of the NAACP. I want to encourage you to get involved. And I want you to know there is a place for you. Regardless of who you are, there's a place for you. There's a team of people who are ready to work with you and assist you as you get your feet on the ground and you're looking at things that you can do to get solutions for your neighborhood, your community. But everything really boils down to is being educated, being engaged, and getting involved and taking action. It's about taking action. It's not going to work if you're not willing to take action. So with that being said, I am so glad to have been with you today. I hope this information that I shared today has been informative. I hope it has been something that you can take with you. You can share with others. By all means, share the video, let people know so that we can begin to do more, because that's what we're here for. We're here to help you. And with that being said, this is Georgia. We will see you next week, same time, 12 noon, every Thursday on the best of the 757, the best.
All righty, all right. No doubt about it. You've been listening and watching GA4 Justice on WBDM Network and all your social media formats. Don't forget to share the link with your family, friends, members, and all your social media friends. Until next Thursday at 12 noon to 1, you've been watching and viewing GA4 Justice with Georgia Allen. Until then, I want to say, have a nice day.